many of us think that our DNA is our destiny. Whatever we were born with, closed book, that's it. Not true. As a physician, I have a body of knowledge, and my patients have knowledge of their body. Often said in medicine, 80 to 90% of the diagnosis comes from the history taking of the patient. The patient will tell you, and then the body will tell you as well.
Hello, and welcome to a new season of Power to the Patient. My name is Jessica, and I'm the head of content at MedShadow, a nonprofit foundation that focuses on the often hidden side effects of prescription and over-the-counter medications. We help produce this podcast. In this episode, we're going to flip the script a little bit, and I'm going to interview your podcast host, Dr. Lillie Rosenthal. Hello, how are you?
Hi, thank you so much for having me. This is the other side of the table. This is going to be interesting.
Thank you for letting us talk to you, and I'm really excited to reintroduce you to the audience. Could you just tell us a little bit about yourself?
I live and work in New York City. As our listeners may or may not know, I'm a physician. I practice here in New York. I was trained as a nurse's aide as a summer job, and then I kind of put it together. I'm like, you know what? I love people. I love sciences. Friends and family encouraged me to apply to medical school. At this point in my career, I'm 30 something years in. I love the challenges I have every day with patients and also doing this podcast. It's in me to kind of help people feel and function better. I feel honored, privileged to be in the room with patients and sort of hear their intimate stories and help them on a path to feeling better without the friction of pain, because I mostly see people in pain. So that's a little bit of my story of how I chose my profession. I'm sure I'm leaving out some other boring details, but there you go.
That's awesome. So you're a doctor of osteopathic medicine. Could you say why you chose that path over a traditional MD? They're both licensed doctors, but there's some differences between the two.
What a great question. That's all true. We are both MDs and DOs are licensed doctors. MDs and DOs in the US are fully licensed physicians. We can choose the same specialties if we want to specialize in medicine. I chose physical medicine and rehabilitation. I learned about what osteopathic medicine was when I was in college also. This was a real important time for me. I really wanted to help people at a root cause level. And there was a very intelligent pre-health advisor who said, you know what? I have a relative who is an osteopathic physician, and it sounds like that's something you might be interested in. And I was like, I want to be a doctor. What do you mean? What's this DO stuff? What's osteopathic medicine? I did a little research. I met with a practicing DO in Albany, where I went to college, who was a neurologist. And I read a book on sort of the roots of osteopathic medicine. And it was an aha moment for me. I said, this is exactly for me. The philosophy is that of whole person care with a bit of a preventative upstream approach to health, which totally resonated with me. It was a moment that literally changed my path, and I applied only to osteopathic schools. The only difference, actually, we also learn manual therapy, something called osteopathic manipulative therapy, which is literally hands-on treatment. People always say, oh, are you a chiropractor? No, I'm actually a fully licensed physician. I'm a DO who does manual work, which comes in very handy, all puns intended, in my practice because I treat people with pain and structural problems. That's a bit about osteopathic medicine.
Yeah, I really didn't know that there was a difference. And I frankly, once I did realize there was a difference, I actually was under the wrong impression that DOs weren't licensed in the same way, that they didn't have the same schooling. So I think that's a really great thing to correct.
There are two paths you can take. You can be an MD or a DO, and then there's a host of specialties that you can be. So you can be an MD or a DO and be a dermatologist. You can be an MD or a DO and be a cardiothoracic surgeon. You could be an MD or a DO and be a physiatrist, which is what I am, which is a specialist in physical medicine and rehabilitation. So yes, we are fully licensed physicians. And if you're in a surgical specialty, you can perform surgery as a DO. So there are no licensing restrictions in the US if you're a DO.
That's awesome. Thank you for that clarification. I think it's very important. So along those lines, what is one common misconception you would say people have about your practice?
I love that question because I love kind of surprising people in good ways. I guess one thing that I would say is that the treatment doesn't end when the patient leaves the exam room. Now, that may seem silly, right? Because you go to the doctor to get healthy, you go to the doctor to give you treatment, but so much of our health is in our hands that as a physician, I do what I do in the room, which is a detailed history, detailed physical examination. I do manual work. I figure out the puzzle of why my patients are in pain. And I always prescribe homework, as I say. I always warn my patients that they're going to have some homework, because if you think about it, if you're waiting for your doctor to keep you healthy, you're in the room for maybe an hour or 30 minutes, right? You live with yourself for the other 23 hours of the day. And what you're doing in that time absolutely matters. So I always say that it's a partnership. As a physician, I have a body of knowledge, and my patients have knowledge of their body. And it's a conversation of figuring out together how we can figure out what's going on, how we can get you feeling better, and how we can prevent some of the problems that you're having from happening again. I think that's a surprise, because I often hear, wow, I never had a doctor like you. Nobody's really asking me these questions. And often, I hate to say, a lot of people are not even getting a physical examination, which is part of reading the body and figuring out what's wrong. So those are maybe some of the surprises that my patients have. And I believe and think and hear that they're good surprises.
So why would someone seek out your type of practice specifically, and what type of person or types of people do you often see throughout, your week?
Yeah, I have a really interesting job. I see people of all ages, in all levels of mobility. I don't treat infants, but I treat kids. I treat teenagers and even sometimes younger, but mostly adults. And most people walk through my door because they have some sort of pain. It could be head to toe. And some of the common things I see are muscle problems, joint problems, disc problems, nerve problems, headaches. While many people in my specialty, which again is physical medicine and rehabilitation, or physiatry, same specialty, many doctors treat pain with pills and procedures. I have a different approach. I try to solve, which I call the pain puzzle. I try to identify the root cause, and I'll say causes, because often there are multiple causes for the pain. If I know that there are things that can help patients with a low risk, low side effect profile, I'm your doctor, right? I want to figure out what is it that got you into trouble, how we can get you feeling better. And then I'm not done. I try to prevent it from happening again. So really anybody in pain who wants to feel and function better, and they want an approach that is kind of deep root cause with the least amount of side effects. So I would say that's what I'm good at, and that's what I help patients figure out.
That sounds great to me. That sounds great to me. In a time when everyone's taking a lot of medication, it's nice to know that there's the possibility to help yourself with chronic pain without, medication. In that same vein, you say one of your specialties is pain management. What we were just talking about, when someone hears pain management, a lot of times they think pills. That's the only way that I can solve my back pain or my sciatic pain or something like that. So how would you describe the way you approach pain management? I think you described it a little bit, but please go into a little bit more detail.
Thank you for asking, because of course I have more to say. What I think of when I see somebody with pain is I see it as an opportunity to, yes, as we've talked about, figuring out that puzzle. But I see it as the body is telling us something. The body has intelligence. Even when it's not working great for us, the body has intelligence. So if we can use that, I'll take any help I can get, because I really want to help people feel better. So I'm listening to what the body is telling me, not only what the patient is telling me, which I'm approaching with a lot of curiosity. Tell me about your pain. Where exactly? What is the intensity of the pain? Is it stabbing? Is it burning? Is it a 2 out of 10? Is it a 10 out of 10? I will care even if it's a 0.5 out of 10, because it matters. It doesn't have to be the person is sort of screaming and, in terrible pain, but pain is annoying. Pain is friction. Pain holds us back from doing things we want to do. and need to do in our life. So I take it all very seriously. So I ask them that surprising question of, what do you eat? How do you sleep? Right? Because these are all factors in feeling well or not feeling well. I ask them about their posture. I ask them about their exercise. And I always say, I promise I am not the food or posture police. I'm just trying to figure this out with you. And the more detail you can give me, the better I can be at solving your problems. So that's the history taking. All doctors learn two very important skills, which I am really sad to say is not the mainstay of evaluating patients anymore. And it should be. It's the history taking, which is the questions that I've just alluded to. And then it's the very important technique of examining the body. That may sound crazy for a doctor to say something so basic, but I can't tell you how many patients have been to, sometimes I'm not the first line. They've been to several doctors who have put up x-rays, said, I don't know why you're still in pain. X-ray looks good. And they never examined the patient. The body is a treasure trove. Does anybody say that anymore? A treasure trove and a well of important information. When I put my hands on a patient and examine things like the texture, the tightness of the muscles, the neurological examination, the range of motion, I get so much information from the body. And as I like to say, the body doesn't lie. The body is telling us if we could just put an ear to listen to that. I often say that my best diagnostic tools in this age of artificial intelligence, it's my ears, my eyes, and my hands, because my ears to listen to the patient, my eyes to observe, and my hands to both diagnose and treat. So I'm very conscious that I'm not treating an MRI or an X-ray. Sometimes I get imaging studies, but often I don't need to, because I'm treating a human being who's in front of me that I can get way more information from. If I'm stumped, I will get an X-ray. If I can't figure it out, I will, of course, use an imaging study. But we often do that backwards. There's a lot of doctors who will get the imaging study and then talk to the patient, and then we're not getting all the information. There's not enough data points. So as I said, I'm interested and curious in figuring out as many data points as I can. And that's the conversations with the patients. That's the physical examination. And that's my 30 years of seeing people and kind of knowing what's up. And all of this is evidence-based. It's often said in medicine, 80 to 90% of the diagnosis comes from the history taking of the patient, because the patient will tell you and then the body will tell you as well.
That's awesome. And I know I keep saying that's awesome. Something else
I'll take it.
So one priority at MedShadow is to help educate our readers on how lifestyle changes may actually help them either get off or maybe even avoid medication at all in some circumstances. And I just wanted to know what your point of view is. I think you alluded to this a little bit, but if you could go into detail about lifestyle changes, about food, how those can actually help someone who is dealing with chronic pain.
This is a mind-blowing statistic that a lot of people don't know and a lot of doctors don't know. 80%, 80, this is evidence-based, of how we age, feel, and function is due to our everyday habits. I'm going to say it again because it deserves repeating. 80% of how we age, feel, and function are due to our everyday habits. Basically, health is habits. So much of our health is in our hands. Now, I'm not saying go out there, read something on social media and do this yourself. I'm not recommending that at all. I'm going to proceed in a couple of minutes to literally digest the evidence around this. And I'm going to use a sciencey word, which is called epigenetics, right? We've heard of genetics. We know we have genes. We know that's passed along into our families from our biological parents. And many of us think that our DNA is our destiny. However we were born, whatever we were born with, closed book, that's it. Not true. Things like cardiovascular disease, cancer, diabetes, these are not pre-programmed. For sure, we have predispositions to certain things in our DNA, but we are missing a huge opportunity to choose habits that can either help or harm our health. I always say this lands well on people who want to do something about it and doesn't land so well on people who just want the magic pill, so to speak, right? And there's not perfection here, but there's some basic things that we know that can help us feel better and extend our life in a way that we are healthy. It's not just about longevity, but it's about feeling and functioning well. Everybody wants a quick, easy fix. I get it. We're working 2 jobs. We have kids. Work is stressful. I understand that. I'm a human who lives in society, and I understand that. But many people don't know that they're like 2 weeks away from reversing their diabetes if they change their diet, type 2 diabetes. Many people know that they can dramatically change their risk. I just read it this morning about cancer. Things are complex, and we all want sound bites or a pill of something that's going to happen immediately. But I assure you, and I have patients over the decades, 3+ decades of practicing that have made lifestyle changes. As a physician, I regularly speak on this subject. I have this conversation every day in the exam room with my patients because it is that important. So yes, MedShadow, and there's a reason why we work together, is because we know, but oftentimes people don't know, that every single pill has a side effect. And for sure, when you need a medically necessary intervention, a pill or a procedure, that is a good move. However, we are way over prescribed and medicated, and the side effects are literally killing people. So having a no side effect or de-prescribing medications, right? Preventing yourself from being on a medication in the first place, and then the opportunity to not have to take a medication with all the risks and side effects that come with it, I think that's a better plan. But it does take some investment in the idea and also in the habits.
So you have been a consulting physician for the New York City Ballet, American Ballet Theater, Metropolitan Opera, MTV Video Music Awards. I don't know if they're still going on. I think they are. And several Broadway plays. So what have these experiences taught you about pain management and injury prevention in active individuals?
Yeah, I think your question is, and we may have some of these things from an old bio, but yes, I've taken care of very high level athletes, musicians, performers, people that are very serious about their health. And in this collection of high performers, right? Everybody thinks, well, I'm not that, so I don't have to. But it's the show must go on in a way, right? There's people, you have to kind of get through this. So often people who are high physical performers, athletes and musicians, artists, speakers, people who are, I put in my high level business people who are running around the globe with no sleep and time changes. And right, like life is difficult for everybody in different ways. But the message is I treat all of my patients as gold medalist Olympics, because why not, right? Olympians, right? Why not, right? If I have the information for people to be feeling and functioning at peak, I literally digest the science and present concepts to everybody. If you're a Broadway performer, a New York City ballet dancer, a working mom, a non-working mom, seniors. I have patients in their 90s. I had a patient in her 90s who was taking dance classes and she wanted to continue, and she put her leg up and her problem was, my leg is just not lifting as high as it used to be. I'm like, and she was studying higher mathematics, right? So at any stage, at any age, we can all work towards living a life where we can enjoy without the friction of pain. So the body's made to move. So I treat patients with Parkinson's disease. I treat patients with orthopedic injuries. I treat patients in all levels of pain. And I meet people where they're at in helping them move in a way that's safe.
this question is all about this podcast, The Power to the Patient. What motivated you to start this podcast? Yeah, basically, what motivated you?
As you probably can tell, I really like talking about health and helping people get healthy. And like many people during the pandemic, I had a little time on my hands and I said, you know what? Haven't written my book yet, which seems like a giant effort, but I really am interested in getting messages that apparently a lot of people don't know how much their health is in their hands. So I approached Sue, the Robati, the founder of MedShadow, because we are so aligned on this message. And I realized that it was a time when podcasts were gaining traction. And I thought that having conversations, because I interview patients all day, every day in the office, I thought it would be valuable to just get this message out there. Just letting people know through the stories of others what is possible. And I thought, I have so many patients with so many great stories and people who have taken their health in their hands in different ways, changing their food, turning off their computer at night, getting better sleep. So I figured, okay, I could interview people. I don't mind talking, but I really wanted to highlight regular people who have stories about how they found their health, and hoping that our listeners would be inspired that if Bob can do it or Susie can do this, maybe I can make some steps towards better health, just to let other people know that they're not alone in trying to kind of figure it out. And Sue graciously said, yeah, this sounds like a great idea. My staff was wanting me to do something interactive for a while. So it kind of came together. And I'm super grateful for MedShadow for being the tech end of this, and you, Jessica, for interviewing me. Garnell for being like the brains behind the technology, to, get this out there, because there's so much suffering and pain, literal pain, physical pain, mental pain that can be, avoided if we just did things a little differently. So that was the inspiration.
I love that. This is a really powerful one. So what advice would you give someone who is currently living with chronic pain? Now, I know I've been through, I won't say chronic, but I've had some issues throughout my life where like the pain was every day. And it really does a number to you, like mentally and physically. So I think this is just a really important question.
Yeah, there's so many people living with pain, acute pain, chronic pain. And just as you said, Jessica, the day in, day out, we know this from sort of social science, that I'm just going to give a non-medical example of like, if somebody like throws a baseball through your window, it's like, oh, that's annoying. Oh my gosh, you get it fixed, you're done. But if your closet is just like not closing right every day, that nagging, annoying, low level, a lot of people live with that. A lot of people have excruciating pain all the time. A lot of people have acute pain. I treat all of that. But there's a lot of low-level suffering from physical pain, which is very tied to mental and emotional pain as well. Because again, we are people, right? We're not just a herniated disc or a sprained neck. We are living human beings who also have the experience of pain. We are learning more and more about this. And when we say pain is in the head, that people like recoil on that. What do you mean? I'm not making it up. I'm in pain, right? But we know that the pain centers in the brain, and pain is experienced in the brain, is very connected to the emotional centers. Oftentimes, my patients will feel better just from that information. They're less worried, because there's a lot of worry that comes along with pain. The fear of not being able to walk down your steps, play with your grandchild, run a 5K, take your trip to Paris, take care of your 4 children, right? So there's the pain and the reason. So figuring that out is often super helpful for people. And also know that you're not alone and there are options and things that you can do. Let's get curious and find somebody who can break it down with you about the why this has happened. And then let's not forget the things you can do on your own, those lifestyle choices that we spoke about. Food can be inflammatory. That can increase your pain. Sleep, not getting enough sleep. We know that that messes with everything in our bodies, including increasing our cortisol levels, feeling more pain, stress, fear. I can go on and on and on, but finding a practitioner and a partner, somebody who will work with you on this as a human being and not just giving you something like a chemical Band-Aid with side effects. Not the best idea.
Yes, full agree as well for that. So we are now at our last question. And what would you like to achieve with Power to the Patient? This is an all new season. We're gearing up for some, exciting episodes to come. So what is your ideal for when it comes to this podcast?
Lots of listeners to hear the patients of some incredible guests who have figured out some of their own health issues, who their partners are in their journey towards feeling and functioning better, and really getting the conversation going about what is good health and well-being. We're in tricky times right now. We have some uncertain times on lots of levels of what is good health. And we have a platform too, right? Who do you trust? Where are you getting your information from? It's tricky and scary times. So I hope especially now to add evidence-based value to these conversations so people are guided in a direction that makes sense. And I get it. It's tricky. So when I say take your health in your hands, I don't mean following the recent influencer who's telling you to do something that can maybe harm you and doesn't really have evidence behind it. I want to change people's thinking of how they approach their health. I want people to rethink, to be inspired, and to be empowered by the guests, but also seeking evidence-based solutions to improve, not only reduce their pain, which is what I generally see people with, but to improve their health in general. So I hope to support all listeners in this endeavor to not only learn, but to be inspired to take action.
That's so great. And if there's someone listening right now and they have a story or they want to contact you, is there an email address or a good way or a website or a good way for them to contact you with their story?
I'm happy to accept direct emails to my email or anything that we've said for clarification, but Dr. Lillie, DrLillie Rosenthal @gmail.
Awesome. Thank you so much. It's so great to be reintroduced to you.
Aww.
And you have such an interesting background. And it's sort of, for me personally, it's like the exact type of doctor that I would look for, because I am always wondering, where is this coming from and why won't it go away?
That's the right thinking for sure. You did a terrific job, Jessica.
Thank you.